IPOS Dem stands for Integrated Palliative Care Outcome Scale for Dementia. It is a short questionnaire which is used to assess and understand concerns and priorities for people living with dementia. The IPOS Dem is used to support holistic assessment of a person with dementia's health, needs and concerns. This includes social, psychological, spiritual and physical needs, and also identifies priorities of care that the family might have. The IPOS Dem can be completed by registered staff, like a registered nurse, social worker or physiotherapist, but also by a person living with dementia, a care assistant or family carer. The person living with dementia should always be involved in completing the IPOS Dem and encouraged to complete it without assistance if they can. However, if they are no longer able to participate, then the IPOS Dem should be completed by a proxy on the person's behalf. A proxy is someone who knows the person with dementia, like a family member or a health or social care professional. It should ideally be the person who knows the person best and who has spent the most time with them in the recent weeks. It is important to remember that a proxy's view of symptoms is based on their individual knowledge of the person, so it is best to check with others who know the person well of their interpretation of how symptoms and concerns are affecting the person with dementia. We know that people with dementia may not always recognise some of the problems they experience, or may have difficulties expressing concerns or needs. Whenever possible, try to understand the person's wishes and concerns. For example, find out about any previously expressed wishes, consult others who may know them well, and observe for any non-verbal behaviour that may indicate pain, discomfort, preferences or dislikes, for example. The IPOS Dem should be completed at least once a month if the person with dementia and their symptoms are stable. You may also wish to complete it at care plan reviews, as it may help inform next steps. If you notice any changes in symptoms or the person with dementia becomes unwell, it is important that the IPOS Dem is completed to determine what is happening. You can complete the IPOS Dem as frequently as you feel is necessary. Once you have completed the IPOS Dem and identified any concerns, you should determine the priorities and use the decision support tools to inform plans to address the concerns. If you are a person with dementia or carer, you may wish to discuss this with others close to you or with a health professional. If you are a health or social care professional, you may wish to discuss with a colleague, a senior member of the team, or a professional with the relevant expertise. Remember, it is important to regularly reassess the symptom to ensure the new plan is working, and so you will need to recomplete the IPOS Dem or use the decision support tools on several occasions for the same concern.